Short version, this is a realistic and quietly serious medical story. LeBron's sciatica is common and often manageable, but in a 40-year-old elite athlete, it's exactly the kind of problem that demands caution, conservative ramping, and an honest conversation about minutes and role. Dr. Todd Albert's take, a spine surgeon's view, explains why. Sciatica usually reflects nerve irritation from a lumbar disc issue. It peaks around LeBron's age, and the difference between a quick rehab and a long-term complication often comes down to whether there's real weakness or progressive neurological signs. What sciatica actually means, brief. Sciatica is a symptom, not a single diagnosis. Pain or numbness that follows the sciatic nerve down the buttock and leg. Most commonly, it's caused by a herniated or bulging lumbar disc pressing on one of the nerve roots, L4, L5, S1. Other causes exist, stenosis, inflammation, but disc problems are the frequent culprit. The important medical distinction is whether there's only pain, usually manageable, versus neurological deficit, weakness, reflex loss, bladder, bowel changes. The latter is the red flag that pushes treatment and timelines. Why LeBron's age matters. Dr. Albert points out that people in their late 30s, early 40s commonly show disc changes on imaging. That's not abnormal. But in athletes, those findings only matter if they press on a nerve and produce symptoms. Age affects tissue resilience and recovery time. A top-tier superstar can still rehab successfully, but the margin for error narrows. Typical recovery pathway, what the Lakers are likely doing. 1. Symptom control and testing. Imaging, MRI, careful neuro exam to rule out weakness or severe compression. 2. Conservative rehab, anti-inflammatory measures, core stabilization, targeted physical therapy, graded aerobic work, pool, jogging, on-court drill work. 3. Functional return, progressive transition to basketball activities, individual drills, controlled 5-on-5, then full practice and game clearance only if no recurrence of pain or new deficits. 4. Surgical consideration, only if there's persistent, severe compression with neurologic deficit or if conservative care fails over months. That's rare and would be a season-altering event. What Dr. Albert warned about, the practical risk, bending and forward flexion commonly aggravate disc-related sciatica. Basketball's movement patterns are mixed, lots of extension and pivoting, which can be tolerable, but certain maneuvers might flare symptoms. The real worry is weakness. If LeBron shows measurable loss of strength in key muscle groups, foot drop, ankle weakness, the team must escalate evaluation and slow the return. If he has only pain without objective weakness and responds to therapy, a mid to late month ramp, as Karania reported, is plausible, but not guaranteed. Team and roster implications. The Lakers are currently thriving with Luka running a heavy offensive load. That gives them breathing room. That's crucial. Load management and minutes control for LeBron should be a planning priority. Short term, keep him off heavy back-to-back burdens. Use G League or controlled 5-on-5 minutes to test tolerance and protect him from repeated high-contact scenarios early. Long term, LeBron's free agency and contract questions make the calculus trickier. The team must balance short-term returns with preserving his availability for playoffs and future seasons. Practical timeline expectations. Best case, imaging shows no severe compression, symptoms settle with PT, and he's cleared for limited 5-on-5 work mid to late November, consistent with Karania's sources. Cautionary case, recurrent flares or any new weakness would push the timeline into multiple weeks or months and might require advanced interventions. Surgery would be a last resort and season impacting. Bottom line, LeBron's sciatica is not on its own a career death knell. Many athletes recover fully, but it's exactly the sort of injury that rewards patience, objective monitoring, and conservative ramping. The Lakers' best approach, treat the medical data as primary, MRI plus neuro exam, use meaningful on-court functional tests before clearing him for game minutes, and manage his minutes like a precious resource rather than gambling on a quick fix. If he comes back feeling great with no weakness, the team benefits immediately. If symptoms recur, the wise move is to pull back and preserve him for the long run. If you want, I can turn this into a short FAQ for Lakers fans. What to watch in practice reports, warning signs to track, how load management might look game to game. Want that?